Good afternoon, everybody. Welcome to Civic TV, women's show. Today we're going to have a conversation on the COVID-19 pandemic. So we've been at this pandemic for almost a year and a half, more than 18 months, and so many things have happened. Between people being sick, people losing their incomes, households changing, increases in violence and increase in care work for women. There's been lots of things happening, and it has caused a lot of mixed feelings in the country. As a country, we're dealing with grief, we're dealing with loss, but also the angle of governance issues that at this point, by now, we should have had better responses from government, but it is a mess as it is. And specifically, it's a mess generally for the whole country, but women have been disproportionately affected by the pandemic and all policies and practices that have been put in place to curb the effects of the pandemic. To share their thoughts, expertise, and wisdom with us are a set of panelists who, one, do a lot of work around women's issues, but also some practice within the medical field. So as we have this conversation, I would like to invite our panelists to have a minute to speak to us. I'll start with Ms. Faith. Faith, you're welcome.
Thank you. Thank you, Maria, for having me. I am very happy to be joining you today in this conversation, and especially given the impact that COVID-19 has had on women. I'm Faith Lumoya, and I am a development economist by profession, and I'm very passionate about women economic justice. I currently work with Akina Maama Wa Africa under the Economic Justice and Climate Action Program. Thank you.
Thank you very much, Faith. Dr. Fiona, please tell us a little bit about yourself.
Good afternoon, everybody. My name is Dr. Fiona Kalinda. I'm a public health specialist and I'm a member of the board in the Uganda Kingdom, the Uganda Kingdom. I am in charge of health in Chapel County, and I also chair the subcommittee of health in all the 18 counties of Central Region.
Thank you very much, Fiona, for that introduction.
I'm a bit devastated.
So, Fiona, we lost you for a second there. So, could you just, we lost you at Uganda Kingdom. Hello? Okay, Fiona, what I'm going to ask you to do is to turn off your video because your bandwidth is struggling a little bit. So we're going to, so that we're able to hear you better than we can, more than we can see you. So if you can turn off your video, that would be really, really helpful. Donna, I'll turn the floor over to you to introduce yourself and tell us a little bit about who you are and what you do.
Thank you, Maria. My name is Donna Keirunji. I work for the University Forum on Governance with interest in the gender work that we do. And I'm also a student of gender studies at the School of Women and Gender Studies at Makerere. And my study interest part is women economic empowerment through at least acquiring a skill. I am so passionate about having women that are independent, especially economically, because I believe when a woman has some money or has something for themselves going on, then they are a different breed from the normal fellow woman that would largely rely on maybe a handout from a parent or a friend or a spouse. Thank you so much, Maria, for having me.
Thank you very much, Donna. So I'm going to start with you, Dr. Fiona. The one thing that really freaked us out right from the start and even still continues to freak us out right now is the health implications of the pandemic. So we've seen a lot of people go to the hospital. We've seen some people fall sick and have managed to get treated and get well from home. So what has been the effect of the COVID-19 on people's health, and how can women especially organize themselves, but also support in the recovery process for COVID-19 patients?
Thank you very much, Maria. I think we all agree that this is a novel experience. It is totally new, not only to the health workers, but to the general public. And when we talk about health issues, we know that women are at the front line. We are at the front line in the homes. And we know that many people with mild to moderate COVID cases, and even some with severe cases, have had to stay at home because we do not have enough bed space in the hospitals. People don't have transport to the hospitals. People don't have money to pay to the private hospitals. So we really need to talk about home-based care of COVID, and we also need to talk about self-isolation, because many people, you know how our homes are. With 1 or 2 rooms, people do not even know how we can take care of ourselves or our loved ones. And yet women are the primary caregivers at home. Automatically, we are the ones at the front line, even at home. So I would just want to encourage everyone, because we see so many people, first of all, are scared, and any kind of headache that comes, they go on and do self-medication, which is wrong. You must have a diagnosis of COVID to do the medication that you've seen circulating from the ministry about what you can take, the tablets of azithromycin, the paracetamol, the vitamin C and D, and the zinc. Do not self-medicate. That must happen under medical instruction. And then, having said that, there are a lot of things. Let's say you have a patient at home. We had children coming from school. Some of them tested positive, and we need to take care of them without infecting others and without infecting ourselves. So we must observe the SOPs. Keep the masks on if you have a patient. Make sure that people wash their hands regularly. And we have to avoid all those crowded places. Children tend to to go to the shops, take walks, and so on. We have to avoid all those crowded places during this time. And then there's been a lot of things on social media, advice on what to take. People have taken all kinds of concoctions. We want to say that fruits and vegetables are very important at this time. As you see, vitamin C helps people fight the COVID, but we must do it in moderation. You find people taking 8 lemons, glasses of ginger, a lot of pepper, and we've got so many cases of ulcers, peptic ulcers, and some of them are now severe. So we have to do everything in moderation, and not everything on social media is true. Not everything is correct. You may have to ask for advice, because there's been advice on social media, people to take this medicine and that medicine, but we have to be very careful, because you may think you're avoiding COVID and then you damage your liver or lungs. And then the other thing is about steaming. Steaming. That is the hype. But we have to be very careful how we do that, the technique of steaming, because if you do it, you may get severe burns in your nasal membranes, especially if, let's say, you put it in a vessel, a basin or a bucket or saucepan, and you put your head very close to that very hot steam. You may get burns, because the nasal membranes and the throat are really delicate, and we should avoid steaming children, because their membranes are even more delicate. So in as far as home care goes, we have to make sure that we maintain a balanced diet. We have to do exercises. Avoid being in bed. If you have a patient, encourage them to go sit outside, take a walk, because the more you sit, the worse it becomes if it's COVID. So exercises are very important. The mid-morning sunshine is very important, a very important source of vitamin D, which is free. You don't have to buy it from a pharmacy. It is free of charge, and it's very important, even for the people who do not have COVID. And when we talk about a balanced diet, we mean that we have to have a fair share of vegetables. I know this is difficult because people don't have money at the moment, but we just have to follow some of these things. And very importantly, mental health. We have to keep on being positive, do the things you love doing, listen to music, play games together, talk to their children. Don't just tell them to do online lessons and that's it. Because in a lockdown, it's very easy for people to slip into a depression, and then we get things like domestic violence happening. So for home-based care, we're at the front line as women. So we want to encourage all women to take the mantle and know that since we're in charge, we have to take care of our families and have to be strong for them, and also maintain our own emotional health.
Thank you very much, Dr. Fiona. I'm going to come to you, Faith, because there are key issues that Dr. Fiona raised. She talked about how we don't even have enough beds at this point. She also, towards the end of her submission, she talked about the fact that we need to have a balanced diet, but people do not have food. So looking at the current economic policy, fiscal or monetary, that government has put in place, how is that policy or practice affecting the lives of women? And maybe you can also start from what COVID has done to the economic status of women, and then speaking to as well the government policy and what it has done. Dr. Fiona, please mute yourself. Perfect. And what you can talk about the effects of the pandemic on women's economic status, but how government has responded to that, and if that response is enough to meet the current struggles that women are dealing with.
Thank you very much, Maria. And I think it's very good that we started at a point where we are talking about how has COVID affected the health of women. And I like the way Dr. Fiona re-emphasized the issue of the burden that COVID-19 has increased on women, especially when it comes to unpaid care work. And we know that from the time COVID-19 hit this country, the burden has really been on women, whether within the informal sector, within the formal sector. And when you look at, for example, the last lockdown, when COVID-19 had just hit in March, it's the informal sector that struggled the most. And we saw, for example, casual workers having to sleep at their workplaces. We saw market women having to sleep within the marketplaces. I mean, that is something that is happening even now. But I think one of the challenges and the realities that we have remained silent to is how COVID-19 has affected the formal women. And when Dr. Fiona was speaking about domestic violence, I was also reflecting on some of the discussions that we had last year when the lockdown was on, and how domestic violence had skyrocketed. And still the discussion was focused on women who are within the informal sector. But we have seen that, for example, from this lockdown, but also from us not focusing on from a broader perspective, the lockdown of the first lockdown, we've seen that even women who are within the formal sector actually facing domestic violence. Today, we have the narrative around essential workers and non-essential workers. And we've seen certain women within certain families struggle with the fact that they are actually essential workers. Their partners are not essential workers, they are the non-essential workers. So as a woman, you have to get up and do all the responsibility, cater for all the responsibility that you have at home, and then be able to go to do the essential work. And that has created a problem, and that has created domestic violence against some of these women who we also need within the essential sectors that we are referring to today. But also, I think for me, another thing that I have seen is that And now I am getting to how government has responded. I think government did not really learn from the last lockdown. And for me, one of those things I've been reflecting around has been the travel restrictions. Because, for example, we know that there are a number of nurses who do not have access to private vehicles. And so we know that there are those who have to walk to their workplaces to provide this essential service. And yet they also still have the responsibilities back at home to be able to take care of their families. And that then reduces how much time they can commit to 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 the essential service work, which is paid work. And we know that with the kind of policy framework that we operate in today, that is neoliberal, that is capitalistic, that has been left to market forces of demand and supply to even determine whether someone gets paid and how much someone then earns, depending on how much time they have committed. Even within the health sector, we are in a situation where a health worker, some health workers are only being paid depending on how much time they are committing to providing this service. So for a woman who has to deal with care work and then quickly walk, spend a lot of time walking to their workplace, it reduces on how much time they are going to commit there, and so reduces on how much money they are going to earn. And so the burden is actually increasing. And it's unfortunate that some of the programs that government is putting in place, it is not actually doing this kind of analysis. Yeah.
Thank you very much, Faith. And I'm going to come to you, Donna, because you say that you're very interested in issues of women's economic empowerment and how that buttresses women from issues of violence. And now we have a situation where women's economics has really been greatly affected because the vast majority of the informal sector is struggling, and that the bigger chunk of that sector is actually relying on women. So what does economic empowerment actually look like in this current situation of COVID-19? But also, what do you think would be the important things that we can do to ensure that as we go through recovery, women are not left at the tail end of all of this?
Thank you so much, Maria. One thing I would want us to understand is that given the experience from the previous epidemics that have happened to the world, is that with such situations, even the people that have always been vulnerable among society are the ones that are most hit. And we've always known what happens with women, women have a bigger load on their shoulders to shoulder, that you have home care work. You also, most times you find there have been cases of increased numbers of households that are led by single mothers. So we know you have to shoulder your home care work by yourself. You have to shoulder the looking for the food. Everything is generally on you. So such a pandemic worsens the situation. If you're to look at I think South Africa has been much hard hit already in Africa. And in the last 1 year, over 66% of women owned businesses totally closed. They have not yet opened. That is in over a year. And if you were to compare with the statistics of only 30 of the men-led businesses are the ones that have closed. That's an entire 50% gap that you can see. There are a number of reasons that would cause such closures, but the fact that it is women that get bigger hits, it is something that is hard to take in. And also, if you look at Nigeria, over 44% women-led businesses have totally closed. We do not know whether maybe they'll open up or they are not about to open up again. And also, like now looking back home, we've seen when they say, so in the markets, we shall maybe give you some nets, or you can find a net and sleep at your stall. the very first pictures we look at are pictures of women that are sleeping in the stores. Women economic empowerment is broad in a way that when a woman is economically empowered, then they are able to afford the basic needs, the basic necessities of their daily life without having to hustle, or they can easily get whatever it is that they need. So with a pandemic like this, when everyone is telling you find a way to make yourself, but you have no one to sell to, when the women have actually tried to get out on the streets to sell their oranges, which oranges are needed in such a situation, and they are being battered and told to go back and stay at home. It is it is like a catch-22 of sorts, that you do not know. You have your fruits at home, you would want to sell them, and you've already sold them in the streets, and someone is telling you to take them home and be home. I perfectly understand why they're telling us to go home and stay home. But in a situation like this, when someone is telling you it is through these oranges that they will be able to get the salt back home, and you are not giving them, the idea that they can actually maybe be on a street and socially distance from whoever is buying from them, and then maybe make a sale or have something out of it. It all goes back to policymakers, if I can say, that the policies that are passed, the decrees that are, I don't know if they're decrees, the instructions that are passed to these that implement the instructions should maybe be lenient, and should be humane enough that a woman can actually, that anyone, not necessarily a woman, that a person can actually be able to trade in a humane way. That if they're selling their oranges, you can, we've seen markets, we've seen pictures of markets outside of Uganda where they've been able to socially distance the sellers themselves, and the buyers can stand at a distance, and maybe like still the trade goes on, because scientists are telling us that we are about to be with this virus for more months and more days. So we need to find a way to deal alongside the pandemic. And I think it goes back to policymakers and the implementers of the policies that are made, that if these were more lenient and more real to ask questions of, you look at what is a situation as Uganda, what is happening in Uganda, and how best can we work alongside this that is happening, then maybe we could find a way, or look, the best way that we could actually keep in the trade as women in business, as everyone, would be to largely go online, to be able to access social media, to be able to access maybe to access data, to access internet. But friend, our policy makers are not even listening the situation. On top of
Thank you. Thank you very much, Donna. I'm going to interrupt you there because I want to bring Faith in on an issue that you've raised about the issue of leniency and being humane as we make policy. And from what we've experienced, from our experience currently, is that everything that government has been doing in response to COVID has really been anti-poor people, anti-people living in poverty. That Acacia Mall is open, right? People are going, that's 1 year, can go to Cafe Seri, grab a cup of coffee, which costs really a whole carton of tomatoes.
Thank you.
But somehow all the kids and everybody who shows up to work downtown Kampala is beaten up and sent back to wherever it is that they came from. And so how then is it, you mentioned something earlier, Faith, about how government was not even prepared. I think when Donna says be lenient, I think Donna is just also being lenient with the state. I think the state has completely failed to figure out a plan around this thing, and we're going to be here for a couple of months. Like there's no debate about that. So how then can we can we support government, if that's even a thing that's possible, right? How then can we support them in thinking differently about this kind of response? Because now we are here in a situation where I'm certain after these 42 days, they're going to push us another couple of days because they will not have figured out something. Someone said, I think it was Joel Sonyoni, who said that he's not a prophet, but he knows that on 6th July, no money is going to go out to anyone, like they said it's going to go out. But also, I would like you, as Faith prepares to answer that, Donna, I want you to think around the issue of the COVID relief fund that is being given to households, and given the dynamic of households in Uganda before COVID and during COVID, because we've seen how that has changed with issues of violence, both physical, economic, and emotional, how we need to think through that support more carefully. So Faith, over to you, and then before I come back to you, Donna, I'll come to Dr. Fiona.
You know, I beg to disagree with you, Maria, when you say that government is anti-poor. I think in this lockdown, but also in the previous one, government has really been anti-citizens because and for me, I feel like from this lockdown is coming at a time when we are coming from elections, for example, and with all the poor programs that are being put in place, for example, the 100,000 that they are giving out, for me, in my opinion, is really an act of harassing the poor. And fine, when you look at and the reason why I say it's anti-citizens, and it's and I mean anti-wananchi or muntu wa wansi, like you and me, and that person who has, for example, a shop at in Gazaland, that person who has a shop. And I think for me, it's especially those people those Basubuzi, mostly those people working within, and also because we know how much they contribute in terms of taxation, and also how much government is always intolerant when it comes to them delaying to pay their taxes, to pay any kind of payments that is due to government. When you speak about, for example, Acacia Mall, I mean, this is big money, it's capitalism, it is, and it's somehow also linked to the powers that be. And so if we give the example of Acacia Mall or all these other big malls, all those are really government in some way. They have connections, they have shares in them, and that's why for me my concern is really with regard to how government has responded in a pro-poor, pro-citizen manner. And one of the issues I wanted to raise is how urban planning, urban organizing. I think for me that's one of the ways in which government has failed, because to require that in the last lockdown women had to sleep in the markets, and for the head of state to also propose it this time around, I think for me was very unrealistic, because government could have put in place a system where these women, because I mean, they are working in the same place and they are essential. Why not put in place a system where they are able to be picked up and dropped not very far from where they can access their homes? And then, because after these 42 days, a lot of women are going to go back home and they'll probably have been sent away from their homes or have been replaced. I mean, we know how certain men operate. And so when you look at even the 100,000 that is being given, and you do the analysis of what it's going to be used for, women and households need more than just food. When you look at the things that women need, just in a month, you will need you need sanitary towels, you need sanitary towels or whatever is related to that. And some of these we have to buy. People need to buy water. There are certain places where people have to buy water. People have to pay utilities. And we live in a country where nothing is regulated. Nothing has been regulated, and it's such a shame that even when it came to concerns around private health facilities charging so much, and how they explained why they were charging so much, it was still getting down to how much they are buying some of the things that they are using, that the prices have not been regulated, that the prices of, for example, oxygen have risen up by so much, we used to buy gloves, a packet of gloves at just about 8,000, 7,000 shillings. Today, you will get them at 25,000 shillings, the cheapest. And it's because we live in an economy that has not been regulated, and yet government is constantly drawing from us, that even when we made noise around the OTC, they just went around and changed the name and still came back with the same rate. And it's so disgusting at this point to see that they keep drawing from us but are not willing to even give back to us. One of the other things I wanted to mention was the cost of testing. To deal with a pandemic, one of the things that needs to happen is for people to be able to easily access testing facilities. So just like they did with lowering the cost of testing for HIV/AIDS and making this either free or very low, this is something that could have ideally been done with all the money they've been getting in form of aid, in form of loans. Honestly, one of the things that they should have done is to provide free testing for COVID-19. But it's so annoying that it's even something that they do not want to talk about. Yeah.
Thank you very much, Faith. Dr. Fiona, I want to bring you in at this point because there's been a lot of conversation around issues of funding, access to PPE, access to medicine, and because people cannot even test early, they end up coming to hospitals when they're in a critical situation, and that has even made it worse for medical workers. So I would like you, Dr. Fiona, to speak to the current struggles of medical workers, especially because the highest percentage of medical workers is actually women, because the nurses who deal with the everyday care of people who have COVID are women, and how has that, if we don't have access to protective equipment for them, how then can we be able to support all the fact that medical workers themselves are also unable to afford the hospital bills? So what's the current situation of medical workers, and how can that as well be improved? Dr. Fiona, over to you.
Yes, thank you very much. The issue of health workers is very important. Like you rightly said, Maria, women are at the front line. We have more women at the front line than men. Doctors, we have nurses, all the support staff, the ones who clean the wards, the ones who serve the food, most of them are women. And when we talk about the things that they need, at least to be facilitated, because we all know that this is very, very risky. And as you've been seeing the statistics, we've lost quite a number of doctors, almost 1 to 2 every day. You hear doctors dying, and nurses, and so it's very important. Personal protective equipment, PPE, is mandatory. It is a right for all the health workers, but in many cases, these are not enough. You find that in some hospitals, the gloves are not there, or they are not enough, the masks, and yet we know that, health workers are supposed to change, whatever protective gear they're putting on every 4 hours. So if you're on an 8-hour shift, you must have changed, halfway the shift, but this doesn't happen. And then when we look at the risk that we take, people should actually be paid risk allowance on time, not in arrears, not saying it's in the bank, but it should be paid on time, because there's a lot of risk, not only to the health worker themselves, but also to the family. Many of the health workers have children, they have spouses, they have children, they have dependents. And when you come from the COVID ward, when you come from hospital, you reach home and the children want to embrace you, you have to first, go straight and have a shower, take off those clothes. It's not easy. Health workers, really need their allowance. And now that there's a lockdown, many of them have had to come and stay within the hospital premises because they cannot afford to be walking, facing roadblocks, all kinds of things. So many people are separated from their families because they have to stay near the hospitals where they have to do shifts. And they stay away from their children and spouses at this very difficult time, when children are supposed to be doing online lessons, when some of their family members are sick, but they just can't afford, the health services. As you know what is happening, the health services are very, very expensive, not affordable for the ordinary health worker. So we are saying that the PPE, government must see how to increase. We know that the people are trying, like you saw, KCC is trying and so on. People are trying to have protective gear, but this is a right, and every health worker must have all the protective gear they need at their disposal to be able to at least face this risk more safely. And then when we talk about the transport, I don't know what will be done, because for health workers to stay away from their homes is difficult, from their because they also have children, and then others who go back, some are breastfeeding, some, it's also traumatizing. And the health workers need psychosocial support, they need emotional support, because facing death all the time, well knowing that you could catch this very virus and that will be you, and you may not be as lucky to get a bed or to be in ICU, mainly because you may not have the money or there may not be beds at the time and so on, is not easy. So we need to consider the emotional health of the health workers. And then we also need to I want to talk at this point about the other diseases, because COVID is not the only disease. There are other diseases, especially affecting women. When we talk about maternal health, there is now lower uptake of antenatal care services, and we know that these are very important in making sure that mothers are safe during their deliveries and the babies are also safe and alive. HIV services, cancer services, all these have actually suffered because of the lockdown. There's transport that, some people get their HIV services from another district and now they cannot cross districts, now they cannot go past the roadblock without the stickers. Although I know that the ministry said that the policemen should be a little bit more empathetic and look at the medical forms. Some people have missed their treatments. People with cancer, people with HIV have missed their ARVs. So we know of women who have had difficult deliveries, and because of the lack of transportation, some of them have not been able to make it to the health centers to be facilitated. So we are saying that we must not talk about COVID alone. We must see women's health or the general health as a whole and make sure that all the other parameters do not deteriorate as we're trying very hard to control this pandemic. So in as far as the money is concerned, sorry, I forgot to talk about teenage pregnancies. It is a very big concern, and we cannot just say that, turn a blind eye to what happened in the lockdown. We must have learned something in the past lockdown. So for parents, we just say, please look out for the children, those teenagers. But we're also having unwanted pregnancies because the uptake of family planning services, the uptake of sexual and reproductive health has also gone down. So all these need to be handled in a multidisciplinary way. We're saying COVID, yes, but then we should look at the health of the health workers, their facilitation in terms of transport, their allowances, and very, very importantly, their personal protective gear, but we should also look at all the other services, especially for women. Thank you.
Thank you very much, Dr. Fiona. I think that was a very, very important analysis, because a lot of times we have now, like, our minds are all stuck on COVID without realizing people actually have, like, other things are happening, that ICU places are full with people of COVID, but those places being full means that people with other chronic illnesses cannot actually access healthcare. If I fell sick right now, I'm not even sure how I would go to the hospital, because how do you, like, at what point do you run to the LC1 and also be able to get the necessary data? But also you can reach a police station and or a roadblock, and the police doesn't think you're sick enough to actually go through. So it's really, we're dependent very much on people's feelings and emotions as opposed to actual real strategy that moves a lot of pieces together. I think for me, one of the most fascinating stories was the story of Ginger and Buyukwe in Jeru, that at the bridge they put a roadblock, but half of the people who actually work in Njeru, who work in Ginger Town, live in Njeru, and they couldn't go to work. They were not like other districts. For example, like where I come from in Maracha, it's very difficult to put like a border stop, but there at the bridge you can't swim across the river to get to the other side to go to work. And so again, which also speaks to the fact that maybe we've not engaged enough people who are experts on how societies operate to think through our strategic issues. So we're thinking economics, we're thinking security, we're thinking health, but we're not thinking about how our societies are organized and what that means for the kind of COVID response that we create. So on that point, I want to come to you, Donna, on the issue of the COVID relief that is supposed to be sent out on 6th of July. So government has picked out about half a million, a little over 500,000 households to which COVID relief is going to be sent. They said they based this figure on the data they got from the last National Household Survey, which I think was released a couple of months back. But we have historically known from just compensation from any kind of project that has happened in Uganda, whether it's road construction, whether it is emptying space for any kind of public good, that when compensation in cash is sent is given to individuals, whoever will be identified as the head of the household in that moment, that money changes dynamic. Today it's even worse. Previously it was easy because what did they do? They came to the home, saw the home, visited, asked who's the head of the household, and then got consent. Now they are going to send mobile money. I can deny or I cannot confirm or deny whether I've received money or not received money. It's really dependent on how much trust exists between people in the household. So how are we going to manage that dynamic? And what are the struggles government needs to be alive to as it takes on this approach as a way of response?
Thank you so much, Maria. About the COVID relief fund, one, we can draw examples and experience from the last lockdown, when government was able to give the handful households the relief that there was, the portion on the bins. Yes, we may say it was poor quality or what, but at least it was able to take a few households out of for some time. But then we clearly saw that even then, I don't know if then it was also for the vulnerable poor, but very households that were able to actually fend for themselves got this relief fund.
I remember Dr. Emmanuel Aineviona from Ministry of Health took a picture of how Posho had been delivered to his home, and we were all confused because in Kololo.
Thank you. So you can imagine then it was a physical, you come to someone and actually notice that, oh, this is Maria. Maria works somewhere. Maria has maybe can afford some more savings, but then you've given them food. And very many households let's keep it in Kampala. Very many households down Katanga, down Bwaise were not able to get this food. But like you said, an entire PS of a ministry was able to get the relief. So you can imagine now that it is going to be behind someone's technology screen that they will decide who to send. She says it will be maybe not more than 100,000 to someone who can able to get 100,000. Then I mean, so what do you expect? Who will get this money? Like Joel actually said, there is a possibility of they will tell us there's at least people got the money. I mean, who are going to say you actually got the money or you didn't get it? Like how? Then the other thing, okay, in case it comes through, and you this father of 10 with 4 wives gets the money, gets 100,000. I mean, what is that 100,000 going to do for this family of 10 with 4 wives? I mean, that means that is 4 independent households. And I mean, also the father, I mean, the father that has got the money. You get? The other day, Dr. Chiza was on TV and he was enraged about 100,000 for 42 days. 100,000. What is it supposed to do for in our economy? You know, there's always been memes on social media about the 50,000 note that you see it there being 50,000, but remove 1,000 and you get what it can do for you. So you can imagine. I'm not trying to ridicule what the government is doing. It is trying. I mean, they can only try for us. It is a good initiative that they are giving us this. They are giving us this relief, the vulnerable poor. It's a good initiative that they thought about their citizens. But I don't know how better it would have been repackaged. I don't know this mobile money thing. I know, yeah, there's bulky send out of money, but it is a tricky situation that we are in. I don't know, maybe if we can say that poshro and beans was a better idea, because at least for certain there's a poshro and the beans, but this time we are in this, then your 100,000, what happens to the rent? What happened? I saw it was essential needs of cooking oil, and in my head I was like, cooking oil is essential in Uganda, of poshro, of so what happens to the paraffin? And what happens to the charcoal? Maybe I mean, it is. I wish the government could actually understand that this COVID is a problem and it is here with us, and so devise means that are understandable for us to work through this COVID thing, because it's definite. In a previous time, we had women working for their money. You go work in the garden, do all you're doing. And after the beans that you've planted, gone through hell to have them done, once they are at home, the husband sells them and takes this to drink it. You get? So you can imagine. The woman does the work. We've always known. This has been like a reality for women. She does all the work, she does everything. And once the harvest is done, the man takes over. And that's the end of her sweat. She will never know what happened. So now imagine this, that you're getting free money and this is happening. The whole COVID relief fund could have been either rethought better or repackaged in a different, understandable way. And there can be better ways for the government to let households do. I know in the villages it's easier now that you go to a garden and work out and work, but for now in Kampala there should be better ways. Also, the other thing that is on my head still, outside of the COVID relief, is what is government doing in these 42 days to get us out of this? Are we going to finish 42 days and then the other 14, and once the 14 are done, we go back to Kampala and start afresh? New infections, new everything. Like, what is government doing to get us out of this quagmire? That we shall get out of whatever lockdown, if it's 100 days lockdown, that we shall get out of these 100 days of the lockdown, and there will be something tangible that is stopping this. Like, the government is really now working back end to see us out of this lockdown, a better community, like in terms of nipping this COVID-19 thing.
Thank you very much, Donna. You raise very critical issues because right now we're just seeing that they sent us into 42 days. Then they started saying, okay, this 42 days we thought for that, like the last two days, this is what we've come up with, right? Like we still haven't seen a sign of or even conversations around real comprehensive plans on how to get people out of this. But also what you raise speaks to a bigger governance question, right? Of we cannot fight COVID. We can't fight this pandemic. We can't get out of it the way we want to get out of it if we don't address governance issues. We talked about healthcare and how government has completely chosen silence on issues of regulation at a time such as this, that even now COVID-X was brought onto the market. The production cost for COVID-X was 3K. But all of a sudden, the places where they're selling it at 150,000. So, like, what are we doing as a people? What are we doing as a country? I remember at the beginning of the lockdown, and America is really legit not the right example to give, but I'm going to give it now. There was a town in America where a doctor, the owner of a hospital, tried to, I think, overprice people or something like that, and the local government there threatened to like take over the hospital for that time because they needed that kind of support. Now, of course, yes, we do run a private, we run a free economy, but the idea of we're in the middle of very unprecedented times, we cannot let the market stay as it is because it is going to end up eating people. There's an entire case of hospitals keeping people's dead bodies. I'm really not sure what they want to do with the dead bodies, but also the fact that organ harvesting is actually happening in these processes. So there's a lot of things we need to think about, even beyond the 42 days. So as we come to the end of the conversation, because we've run out of time, I'm going to start with Dr. Fiona. How can we make sure that in our closing remarks, how can we, I'm going to start with Dr. Fiona as we give our closing remarks. What can we do to be able to ensure that health workers are actually done better by? Because we can actually do better by health workers. We're asking them to give more, do more, but we're not even trying, both as citizens, but also as the government. How can we do better by the health workers in Uganda today?
Thank you very much. Well, the health workers, like I said before, we must ensure that all health workers have their protective gear in constant supply. Not these things of out of stock and this and that, but they should be in constant supply. They should get their risk allowances and they should be ensured of psychosocial support. But very importantly, there should be that assurance that if it happens that they fall sick, they'll be able to be taken care of so that there's no financial shock, that you find that there are no ICU beds in the public facilities or there's no oxygen. At least there should be something well organized for that. And one of the things that government should do, is to make sure that we have ICU units in all the regional hospitals. Just this week we lost a doctor who was being transported from Gulu to Kampala. And of course, when they reached around Bombo, she really needed oxygen and ICU facilities, but she was being transferred because she needed ICU facilities all the way from Gulu. Imagine, that is so painful. So they should make sure that they use all the monies that have been given to support COVID to make ICUs in all the regional hospitals. And then we should, in terms of regulation, have a dashboard where we know which private hospitals have ICU beds and at which cost, so that people stop driving all over the city looking for beds, and then they reach the bed is too expensive and then they die in the process. So for health workers, we really need to make sure that they are sorted out in terms of their gear, protective gear, risk allowance, and also support. And that also goes for the ones who need to stay near their families. And because of this lockdown, cannot move because they don't have cars and don't have stickers, they should be considered in a special way. I thank you.
Thank you very much, Dr. Fiona. Just to give you some hope, the Association of Anesthesiologists of Uganda has actually designed an ICU dashboard. I saw it this morning. I'll share a link on one of the groups that we're on together. And they actually put together which hospital has ICU, which one has the HDU space, is it full, how many people on their waiting list and stuff like that. So I think this is also going to ease the process. Of course, the challenge with this is that people who don't have access to information cannot access this kind of data, but I think it's a really, really great beginning point. So Faith, to you, I want you to focus on how can we ensure that even as we try to recover or just even go through this pandemic, because I don't think we've come at the point where we are recovering as a country, what kind of policies do we need to put in place to ensure that there's economic justice for women through this entire process?
Yeah, thank you very much, Maria. I think for me, what I would want to see government doing is to put in place support that is not just short-term in nature, but support that will actually deliver long-term impact. So when you look at, for example, a relief, one of the fears is that it may cause inflation. But it's also very short term. Before the lockdown happened, government had proposed the yoga, and yes, there were concerns around it, but it has suddenly dropped this conversation. And I think what government needs to do is because COVID-19 has also showed us that this business of walking a very long distance, for example, to access healthcare, to access education services, to be able to find a job will not work. So government needs to reorganize us and make certain services more central. So that then we can be able to walk over to those different places, but also put in place facilities that will actually, like I said, result into long-term impacts instead of this business of just giving small handouts here and there. Because when you find the giving out of portion bins resulted into, there were a lot of concerns around the whole procurement, how they had selected who they were procuring from, but at least we knew that the money was going back into the productive sector. But now with the way things are, it's very unrealistic to what extent this money will actually benefit. My last point would be that government needs to look into making COVID tests free of charge, because when you know your status, when you know that you are positive or negative, or okay, if you know that you're positive, then you will quickly start on immune boosting, taking all these different herbs, taking all these, taking precautions basically to build your immunity so that it fights the COVID-19. Because when it's in mild stages, it's easier to fight it than when it has gotten into those uncontrollable stages, a severe stage. Thank you.
Thank you very much, Faith. Donna, how do we make this COVID response and recovery process more meaningful to women, especially given the social context in which women are existing today?
A number of, if I can say, ideas. One, whoever has a business, I think it is best advised that one tries a way to find an online footing to keep in business, because trust me, whatever it is you have that you are doing as a businesswoman, as anyone, it can solve a problem in the times that we are in. So whatever it is you're selling, find a way to push it online, whichever way it is, and there'll be a problem solved somewhere. So I really like having to dwell on the humane point of life through life, because I mean we are first humans. As I conclude, I would want to talk to people. I have been looking for a platform to have this aired out. A number of times I've seen people on social media, on Twitter, on Facebook, explaining how they've beat COVID. And the first thing they tell you is that I got signs, I got flu, I got a headache, it was so bad, but then I had energy, I was feeling fine. So that day I said I could actually go out to work. That is the day you're going to infect someone with underlying issues, and that is the day that someone will not beat the COVID that you're able to beat. So I appeal to everyone, every individual Ugandan out there, the day you feel a cough, they've told us, the day you sneeze out, find a way to not get to public for that minute. I really feel, because I've seen a lot of testimonies where people say, I felt everything, but then I was fine. So I decided to walk around. I decided to visit someone. And then the next day, I really felt like I could not breathe. You get like that day when you're feeling fine is the day you infected someone who could not actually have it off. So there have been a number of nice-hearted people online that have started drives to collect some funds and collect some relief things that can be given to people that need them. I know there are people out there that have some money that they can spare, and someone like, if I can say, if it's fine for me to say, I hope it's not like an advert, like Esther Kalinda.
We'll charge you. But go ahead.
Like Esther Kalinda, on Twitter, on social media generally, she has started a drive to collect some funds to help the health workers.
Yes.
Really. So if you have some little train to spare, and there are such drives, I saw someone saying instead of Fridays clapping for these health workers, we could actually have the Fridays to do something tangible for them. So if you can actually contribute to such drives that are happening, I mean, thank you so much. You're helping the government. Maria was asking how we can help the government. You are helping us, you're helping society, you're being humane, you're being the nice person that we need in society. I think this whole thing, we can, together apart, find a way to help one another, together but apart, and maybe this will also be in history.
Okay, perfect. When you say together apart, well, like my head went together to now wakilisha. You guys, so now you know how old I am. Okay, thank you so much, Fiona, Donna, and Faith, for sharing your knowledge. Faith shared something in the chat section that I think is very critical, that even as we ask people to donate to different causes, we must demand for accountability from government. We must demand that government does better by the people, because we pay taxes above all else. We pay taxes, so we must push that as we even collect to support people in places where they might not be able to be supported, especially by government. But the most important thing is to stick to demanding that the state actually is accountable and does what it does. So thank you very much, everybody, and would like to close this session. Would like to wish you all the best. Please stay safe, social distance, wash your hands, make sure you do stuff to protect your mental health, and make sure you check on your loved ones. Don't let it be a situation of, oh, there's COVID, let me stay by myself. No, check on your loved ones, call them up. When I say check, please don't go and visit them. I say just call them up, do family calls together if you can do that. Share something with your immediate neighbors, especially if they don't have what to eat, or if they're in need of something. That even if we're in the middle of a pandemic, we cannot stop being kind to one another. So that is it today for the Women's Show, and see you again next time. Bye-bye.